Everyone deserves to be treated with dignity and respect, no matter what their diagnosis.
I would never really go on a person's diagnosis. I would usually go on their symptoms, and that would how I would formulate like a treatment plan rather than thinking, okay, you're a paranoid schizophrenic, this should be your symptoms. I think I would always go on, how the person is as a person.
I think in the acute setting, it's lack of knowledge. I think a lot of the nurses that are coming out now, there's a fear factor because the TV and newspapers sensationalise things.
There was a patient with emotional unstable personality disorder again in the past. We'd be getting a lot of complaints from the doctor's surgery that this person was presenting quite a lot. We were worried that the doctor might miss something if she kept coming in and thinking it's her mental health that's causing these issues, when actually there might be an underlying physical health issue that she's trying to get at the point over, but they just don't particularly listen to her anymore. So we had to have a conversation with the GP, which went actually really, really well. But then at the same time, I had a similar issue with the same person's pharmacist, and she wasn't interested. Challenged her, and she just didn't want to know. You could physically see the, oh, here we go. Which is shocking, that people have almost become that cold and just no patience. It sent her mental health, through the roof at times because she wasn't being listened to. So, yeah, work with the person, not the diagnosis.
Try and deal with them as individuals when it comes to more complex problems, or patients who are on lots of different psychiatric medications. Maybe they're on several antidepressants at once. We're not so good when there's 2 or 3, or what ones work well together, or what are good for certain things. If you are in a position where you maybe can't get immediate advice and you have to make a decision, then co-opt the patient and say, look, these are the things that we can try, but this is what might go wrong. You need to be aware of that and informed about it before we start. But look at it with the patient. They don't mind. They'll like you for it. They'll come back to you again.
Yeah, actually it can be a really powerful tool in your practice, and nothing beats sort of working the problem together with the patient. If they feel they're involved with that, if you're a good practitioner and you have the confidence, you'll be able to display sort of, the magic ingredient that you can put into that with helping them make the decisions, just involving people and being honest with them. I think people just appreciate you being honest with them.